Yes, greetings policy members. Your remarks and really look forward to your participation in the meeting today as we discuss 15 action items. As you know, ICAN is LA County's official body to coordinate services for the prevention and response to child abuse and neglect. And although the pandemic restricted our ability to come together this past year, we've been extremely productive with the help of the amazing ICAN staff and great committee members from all ICAN agencies and the community. So here's the year in review. Let's try to get the slides. Okay. April. And the Board of Supervisors joined us in declaring Child Abuse Prevention Month. We weren't able to celebrate with the children at the board meeting, but more on that later. We published our 34th annual State of Child Abuse Report, including data and information from 20 different agencies and special projects. It's available on our ICAN website, icanforkids.org. We also released our 40th annual report of the Child Death Review Team, including data and demographics of child homicides and suicides and accidents and undetermined causes, also available on the website. Since we released our 34th annual State of Child Abuse Report, and since 2001, we have issued reports on safely surrendered infants. We'll have a report on safe surrender later in the meeting. ICAN again sponsored a child abduction training for law enforcement, this time virtually. Also virtual, we held our 17th annual Children's Traumatic Grief and Loss Conference, drawing over 300 attendees. We continue to be so pleased to work with the 12 community child abuse councils. The councils represent geographical areas, Hispanic, hearing impaired, LGBTQ, African American, and Asian Pacific Islander communities. The ICAN hospital network includes 64 hospitals that provide 90% of all birth and emergency care for children under 3 years of age. The Family and Children's Index is Los Angeles County's first interagency data information system. FCI and enhance the county's ability to identify and protect children at risk of abuse and neglect. GERDA, which is the Guidelines for the Effective Response to Domestic Abuse, is Los Angeles County's state mandated protocol for the response to incidents of domestic violence when children are in the home. This training will be presented on the county's e-learning system. So ICAN continue to with our life-saving safe surrender and infant safe sleep campaigns, and we'll hear about that. And everyone here has received our 30-year retrospective child abuse homicide report, a unique report in the nation, released in April. Many of the recommendations today are based on the findings of this report. It's also available on the ICAN website. ICAN's signature annual conference, Nexus, was canceled last year. However, we've reserved the Sheraton Universal for our 25th annual Nexus coming up on November 23rd. Following our no-hit launch with Joe Torre and the Dodgers in 2018, and inspired by presentation of a pediatrician at Nexus, ICAN partnered with Dr. Kel Berkowitz and Harbor UCLA Medical Center to pilot a no-hit zone project. Dr. Berkowitz will present our no-hit zone action item today. So in conclusion, child abuse isn't a law enforcement, it's not a mental health or child welfare issue. It's a system-wide issue, a community-wide issue, a neighborhood issue, and a personal issue. Preventing harm to a child can be as simple as reaching out to a stressed neighbor struggling with 3 small children. We've seen how agencies and the community working together can make a difference. We've had declining abuse fatalities, infants safely surrendered, in-home support, and lives saved. So today we consider ways to continue making that difference. Thank you. And now we'll move on to the reports from our two department heads.
Okay, we'll start with Bobby Cagle, the Director of Department of Children and Family Services.
Thank you very much. The Department of Children and Family Services has continued over the 3.5 years that I've been here to really examine the work that we do, and we're very pleased to have high-level staff members who work with the ICAN board to review cases and to learn from those as best we can, and then to take that information back to the overall direction of our department. We have been working for some time in conjunction with the Department of Mental Health around prevention and aftercare. We have invested over the last year about $16 million in prevention programs that are delivered in our community through community-based organizations. What we found in working with some of our university partners is that those services are better delivered by those community-based organizations because our families are more likely to receive the services and accept them. So we're continuing to invest in that, look at additional ways that we can invest more in that area. We believe that a number of the cases that we currently see actually are low risk, and those low risk cases truly can be handled in a way that does not require the intervention of the Department of Children and Family Services. And what that does for us is it allows us to redirect our internal resources toward those things that, those cases that are much more problematic, much more concerning, especially cases involving young children. These are cases that are very complex. And to say that they involve substance abuse, domestic violence, mental health, I think is only the beginning of it. And what we see oftentimes is that it's multiple factors that are at play in the cases that we look at, which really compels us and calls on us as a department to work better across organizations in county government, with our state government partners, and also with our private sector partners. One of the things that we also know is that our relationship with law enforcement is vitally important. And we have dedicated with the sheriff staff in the Antelope Valley to really join together in the investigation and in the inquiry into concerns that are taken to the Sheriff's Department, and we jointly respond with them in that agency. That again has been interfered with a bit because we have had the COVID pandemic, but we are very excited about the prospect, not just in that area, but really present opportunities that we have to jointly respond with our law enforcement partners so that we are able to do a better, more thorough job. We also are working in the Antelope Valley on a project called Risk Stratification. It is about to be launched in our Palmdale and Lancaster offices, as well as a couple of other offices in our county. And the point behind that, again, is to use data. We're working with the Children's Data Network to prioritize cases, to look at those cases that are of highest risk, and to meld some of the work that you'll see represented in the policy proposals today around how we bring multiple disciplines to the table to advise us on how we do the work, to help us look at the cases with a very critical eye to make sure that we're providing the kind of services that are needed. We also recognize that domestic violence is a very serious problem in our community, one that really requires a different approach than we have historically taken. To that end, we're working with Eve Sheedy and the Domestic Violence Council to review the policies and programs of the department to better align the work that we do with our domestic violence partners. That is ongoing work. We are excited about the opportunities that that presents for us. Also, I think it is very important to highlight that we're beginning work on postpartum depression along with the Department of Mental Health. There are a couple of cases that have been in the media that are clear examples of postpartum depression resulting in tragedy. So we are working at this point in time to actually develop a program called Mom to Mom that is squarely devoted to working on postpartum depression issues. But I think the proposals that we see coming through today really allude to the fact that this is an interagency problem that must be dealt with across organizations, but also in our communities, so that families are more aware of the needs of mothers in the days, weeks, and months following the delivery of the baby. We also are working very closely with ICAN to promote the No Hit Zone campaign, because we believe that the public needs to be aware and that we provide alternatives to families that are in crisis, so that they have an outlet that they can avail themselves of to get the assistance that they may need, and also to really change the community's thinking about the wisdom of using corporal punishment with children, which we know also inflicts trauma. We are also very concerned about children's grief and work with the Department of Mental Health on cases on a regular basis where tragedies have occurred, to link families and children that are surviving with the resources that they need to address the trauma. As Dr. Sharon was saying earlier, one of the things that we know is that trauma that occurs to people, if it is unaddressed, really gets either revisited in ways on the community or revisited on the person themselves, where they are self-destructive in their behaviors. And the assistance that we're talking about today is vitally important in order to be able to bring a stop to that cycle. We also have a couple of matters today about reports. I think the part that I would stress is that our entire system starts with reports. And it is vitally important that we make that as easy a process as possible. We have done that with electronic reporting already via email. We also are, of course, very excited about the proposals today for medical professionals who don't have time to spend on the hotline waiting for an answer. And we're excited to look at the prospects of having a different way for them to engage. And also for text messaging. We do have to come into the 21st century, and we do know that text messaging is the way that many people communicate this day and time, and examining what is required in order for us to be able to accept reports via text message is a step that I think is in the right direction. We also see too often in this county that safe sleep is an issue that we need to do work on. Knowing that children should be placed alone on their back and in a crib is the key to making a safe sleep situation for our young children. Unfortunately, we see too often, and it's very often, that we have children that are placed in the bed with either their caretakers or other children, that they're placed on inappropriate bedding, or that they are allowed to sleep on their stomachs or on the chest of a caretaker. And unfortunately, those end in tragedy. So working on that issue, I think, is something that is vitally important for this community, starting with the birthing hospitals, where information about safe sleep is delivered to parents, and we want to work on that ongoing as well. We're excited about today's agenda, 15 items that all are very important in and of themselves, but I think represent a collective wisdom on the part of this group that really should be lauded.
Thank you, Mr. Cago. We're going to move on to policy report by Dr. Jonathan Sharon, the Director of the Department of Mental Health.
Thanks so much. And Bobby, appreciate all your comments about the partnership, which have grown pretty dramatically, I think, since both of us have been here in LA County. I really kind of want to start by thinking about the context of the past year plus, which highlights so many challenges. And this, the work of this group, the mission of ICAN, I think, has been challenged and stressed by the experience of isolation, of stay at home. The incidents of domestic violence and child abuse, I think, are things we're going to be understanding more and more over time. So this work becomes that much more critical. And I always like to look for silver linings, and I'd like to think that, the policy recommendations and the need for us to focus will pay it forward in times when there is no pandemic, and we'll really be able to have an ongoing impact on some of the most egregious events that we experience as a society. The Department of Mental Health in times, both before and after or since the pandemic, that I believe are creating a lot more access to the general public. We've expanded our helpline, in a dramatic fashion, to reach out and to accept calls from the entire county and people in need. And we've seen a massive increase in the number of calls, and we've increased our capacity, and we don't expect to drop that capacity. We want to keep it up so that we can continue to help people in real time with emotional support, or certainly helping to direct traffic. We also have offered and continue to offer mental health apps so that online individuals can get help when they need it, because that access to real-time support is critical, and it's critical for people who are suffering, who are under stress, and who are in many cases more likely to act out and become violent. With respect to the partnership with DCFS, I mean, we've actually even reorganized the Department of Mental Health so that we sync up and are complementary to work together, much more carefully. We've also done a lot of investment with prevention funding, and Bobby had mentioned that, particularly the Prevention and Aftercare Network. And part of us doing that, and part of us investing in the Department of Public Health and the Department of Public Health contractors for home visiting, is to prime the pump. We have made a very intentional effort to grow capacity in a way that would have an impact, so that when this new funding becomes available, or is becoming available from the federal government for prevention services, that we're already running rather than starting fresh. And we are very encouraged by the fact that that capacity has grown, that we've seen impact, and that we are really primed as a county to move and to get the lion's share of federal funding through their prevention. The other thing I would say is that, the policy recommendations that are being, discussed and deliberated today are the result of a lot of work. And I think Deanne would agree, not just a lot of work, but work that's occurred over a longer period of time than usual. And the thing that I really like about the recommendations is that they are things that we can do. And they're things that we absolutely have to do. And we have to do them as a collective. These are collective problems. They require collective solutions. But we also have to recognize what's our part and play our part to complement what everybody else is doing. And there's several very key recommendations that are, I think, of utmost importance to my department. And, a no-hitting zone or a no-hit zone, I mean, that seems to me to be something that we all have to just embrace really loud and real clear, and to begin kind of a chain reaction, so that there is a commitment to no-hitting. Very basic, very important, and the kind of thing that can influence culture. The second thing that's of immediate relevance to the department is the fact that we need to have access to grief counseling at a different level. We do grief counseling, and we do a lot of work, with the sheriff in real time. When bad things happen in the communities, we generally try with limited resources to run right out to the scene, and they make sure it's safe for us, and we help them support the people who have been traumatized. And we want to grow that so that it can, have an impact on or support and help families heal and grieve when there has been, an adverse sentinel type event. The last thing I'll mention in our clinics, women who are suffering from peripartum mental health issues, before they deliver, after they deliver. This is critical because, what we saw recently in the news is actually not that uncommon. After delivery, developing a serious mood episode, a depressive episode, although that's not always the case. Oftentimes there can be psychotic features and behaviors that are treatable and manageable, go unmanaged, and you can have horrible outcomes. So we need to figure out a way to train up those clinical environments, the people, and make sure that there's linkage, active, proactive, aggressive linkage for women who are, at risk of developing profound mental health challenges that endanger their family. I think, with that, I would like to hand it back to the co-chairs. It's really an honor to continue to work on this stuff. And we have a long way to go, but I really feel that progress is being made. And I think if we're able to convert, to execute on the recommendations of this policy report, that